Hello everyone, today we're going to talk about a case, but it is a case of real life. I talk about the patient, about explaining to the public what happened in her situation. She had an accident during the root canal treatment. And I said, what do you mean an accident? Well, she went to an endodontist that she searched, it was recommended, and I'm sure the endodontist want to do a good job during the root canal like all of us. We all try to do our best. But there are some times in cases like this where the curvature of the tooth is so angulated. I don't see it angulated, but I was not there with the endodontist when he did the job. So during a root canal, as you know, what we do is we open, then we measure the roots. And what do I mean when we measure the root? If we are measuring the root, we're gonna have an instrument that is called a file. And these instruments are gonna measure from the crown of the tooth to the end of the root. So this is your root. When you see here, these are the root, this is the root, and this is the crown of your teeth. So we measure from here to here, and you're gonna hear if you're having a root canal, or you're gonna put a distal 18, distal lingual 17, 19, usually are these roots. But then in the next one, I saw it was a blockage. I was able to bypass that instrument, but I noticed also that it was some kind of opening to the side of that root that we cannot appreciate right here. The patient wanted to get rid of this instrument. There were two instruments inside of the tooth, and they told her it was only one. There's nothing wrong when we break instruments. In my situation, I get upset and I think, what happened? What is this instrument breaking inside this tooth? Sometimes we're rushing. I don't like to see two patients at the same time because these things can happen. But what do we do in that case? The instrument got stuck in the root, and the endodontist couldn't take it out. He put time to try to extract the instrument, and he couldn't. But this is the worst part. The patient was upset because he didn't tell anything to the patient, but the assistant is the one who told her and the front desk that it was an instrument that was separated inside of her root, and there was nothing that they can do, and the tooth was gonna be okay. Now, how much the endodontist irrigate, I don't know. What happened, I don't know. What I do know that the patient came back to my office, because this is a patient, I will talk later about her again, where she had two teeth on the front, and I saved her two teeth with a root resorption treatment, which is something that I have my practice dedicated to take care of root resorption, and it's another topic. So she came back to me and said, Dr. Yacamán, I should have come back to see you because they broke an instrument, and I'm very upset, and I don't want to see never this endodontist again, and I want you to take out the instrument. Taking the instruments from this part is extremely difficult. There are different ways. We use different techniques to try to extract the tooth. And as you see in this image we can see right here, this area, but this part was already perforated on her case. However, the instrument was broken in this side, and I was able to take the one on the other canal out, which was a big success. The patient was happy that we were able to remove one instrument, but the second one was almost impossible. I removed the biggest piece, but then I find out the two perforations that were made here. And also when I sent the patient at the CT scan, when she came here, I found another perforation in this area. What it means perforation? Perforation is that we are working and trying to find the canal. And if we are not careful in this area that is called furca, we're gonna have an opening, and it's gonna be an opening through the gums inside of your tooth. This is a perforation. So she has a perforation here. There was transportation of this part here. Luckily nowadays, we have MTA, which is mineral trioxide. It's a cement that we use in root resorption, and we use it to seal this part so the treatment will be successful. I talked to the patient about extracting the tooth and have an implant in place instead of the tooth, but she did not want to. She wants to save it, and the reason why is because the two canals on the distal were done. We finished it correctly. I took one of the instruments. The second, I just left this little tip here. Unfortunately, I have to seal the furca perforation and this. I saw the patient came to see Dr. Bijak to finish her restoration. And after all this time, the perforation, the furca was placed, the MTA. I like to leave a little shorter this part for endodontists, if there's any endodontist watching this, but this program is only for my public, only for the patients to learn what happens if an instrument is broken inside. It's not the end of the world as long as the endodontist is irrigating, and always my mentor in Mexico City, Dr. Silva Herzog, used to say, irrigate until the patient is below the water. And it was a kind of a joke, right? That the patient has to be swimming because we're irrigating so much. Meaning we have to clean the canals as much as we can to have completed the cleaning of that. I use a machine called Gentle Wave that we have in the office. I use everything possible. I have an article I published of irrigation. So I'm very used to irrigate since I have my first specialty in Mexico and the second one at USC. So now we place MTA here, MTA here. The patient is happy. We finish in December her root canal treatment, and now she has her crown. We have the patient in a provisional crown for a couple of months. Luckily, when I did a retreatment on this patient, the pain disappeared. Now she's happy. We became friends. She invited us for dinner with her husband. We became very good friends, and I just want you to learn from today that when you have an instrument broken inside the canal, be sure that the instrument can be bypassed and they was irrigated to the maximum amount, so this tooth will be surviving. The patient will come every 6 months. There's no charge in the office for complementary treatment. Is to look at the case every 6 months for the first 2 years and then every year. Many endodontists do that. I don't know how many, because this is what happened in our office. But I hope you like this episode, and I hope you learn. It's a broken instrument and it happened during root canals. It's not a problem if the canals were irrigated and it was full. Fill the canals with gutta percha and cover the perforations with MTA. If you have any questions, don't forget, text us on Instagram or on YouTube. Make your comments if you like it. Let us know. You need to know. You can always contact me, and I can talk to you if I need to talk to you, okay?